Open enrollment begins this week, and there are some changes to Covered California that you may want to know about. So here to talk about the changes is health insurance expert Craig Gussin. Craig, good morning.
Good morning, Lauren.
Great to see you.
Always good to see you guys.
All right, so we're talking about the insurance rates and benefit plan changes. What should people know as we get into open enrollment?
Well, Covered California is open enrollment, and anybody who gets their own insurance. Open enrollment starts Friday, November 1st, runs through the end of December. It would go into effect January 1st.
Right.
If you want to make a change in January, or if you get to enroll in December, you can sign up in January with a February 1 effective date. After that, you can't buy health insurance anywhere in the country unless you have a qualifying event. Maybe you lost your job, you lost your health insurance, you got divorced, things like that. You have a baby, that's always a qualifying event where you can add the child to your health insurance. But outside of that, you can't just call me up in June and go, I'm ready for health insurance. Because if you haven't had it in the last couple of months, I can't help you until January of the following year. If you're looking at your health insurance and going, what should I do for 2025? The first thing I tell everybody is don't worry about 2026 or 2027. What are your next 12 months? Next 12 months is, okay, are you gonna have any medical procedures? Is anything changing that you need to know about? Your prescription's changing. Are you planning a surgery? A lot of people go ahead and need hip surgery or knee surgery. I'm gonna put it off to next year. Then we gotta look at the plans. In Covered California, your rates are based on your age, what's your income, what kind of doctors and hospitals you wanna be able to go see, and along with that is what benefits do you need? If you're a typical guy who never goes to the doctor, let's get you a plan where you're gonna pay maybe $50, $60 for a doctor visit. Lab and x-rays are gonna have a copay. Prescriptions are gonna have a copay. If you're somebody who goes to the doctor a lot, you probably want something that maybe has a lower copay for doctor visits, maybe not a deductible for an inpatient or outpatient surgery. So it's really important to talk to a health insurance agent. The California agents and health insurance professionals, that's all we're doing all year long. And if you go to khip.sd, you can go find an agent in the top right-hand corner. It says find an agent. You can find somebody locally that can help you.
And it's not going to cost people anything. That's a big thing because people are scared. They think, oh, if I get an agent, it's like getting a real estate agent or something. What's it going to cost me? And it's not. It's free, and you can guide them because it's confusing. Those packets are massive, and you have to read that, not us.
It is, and a lot of it, there's a lot of things inside you don't know about, such as prescriptions. You know, I know somebody needed to get a prescription with $300. So they went back to the doctor, because I said, call your doctor and see if you can get one that's less expensive. They did that. And then they went and used GoodRx. We went from $300 down to $78. And that's great for somebody like that. You get something like Eliquis. It's $1,250 if you buy a 3-month supply. We use a Canadian pharmacy company out of Tampa, Florida, and we get the same thing for $225 for a 3-month supply. So a lot of it's education, and that's what we're here to do. You know, like you said we don't charge a fee. It's actually illegal in California to charge a fee. So we can help you and walk you through situations of what's the best plan for me. And there is no one situation. Your needs and Paul's needs are gonna be totally different. So let's find a plan that's gonna meet your particular needs this year. We'll worry about 2026 and 2026. Yeah. You know,
and if someone's sitting at home and they have an insurance plan already through their employer, or maybe they're on a Covered California plan, but they're thinking, I wonder if under these new rules, if there's a plan that could better suit my needs, they can still talk to you and they can change.
And we can look at a lot of different options. If you have an option to get health insurance like you all do here, you cannot go to Covered California unless it's going to cost you more than 9% of your income to get health insurance from your job. And we had a woman who was in her 60s making $25,000 a year. She was going to pay like over $700 a month. We found her a plan in Covered California, and actually because of her age and income, she paid nothing.
Wonderful.
So we went from somebody who had, in that situation. So that's one of the things to think about. You know, you have kids, so you start thinking about, are you going to see your kids on TV with Paul in sports? You may want a better plan than a plan where, you don't have those situations. So if the kids aren't using it a lot, or you don't use it a lot, that's the thing to look at. And like I said, I've had clients who've said, I need great coverage, I'm having a baby in 2024, and now it's 2025, and they go, I don't need that richer plan. So we see both sides of it, and that's why it's so important to work with an agent. We're going to be we're outside looking in. And most people spend more time planning their vacation than they do planning their health insurance. And it's really important to look at what's going on in 2025 for them.
All right. Well, Craig, give us the website again where people can look up and find an agent.
It's CAHIP-SD. Top right corner says find an agent. Go in, put in your zip code, and you're going to find a bunch of agents that are local to you.
All right. Craig, thank you so
much.
My pleasure.
Always
Good to see appreciate it. And my kids know they have to wear extra bubble wrap anytime they hang out with Uncle Paul. Prevent injury.
I don't blame you.
All right. Well.